Hello, in this video we will be looking at the tympanic membrane, also known as the eardrum. Some topics which we will cover here are the development, anatomy, parts and the site identification. The first topic is development. It develops from three layers of the embryonic disc. They are ectoderm, endoderm and the mesoderm. This is the tympanic membrane. Here we are viewing it laterally to look at the layers. The outer layer is ectodermal. The middle layer is fibrous. It contains radial, circular, and parabolic fibers. The inner layer is mucosal. Let's look at some characteristics. The normal color of a healthy tympanic membrane is pearly gray and it is translucent. It makes an angle of 55 degrees with the horizontal. The surface area is 90 mm square and the effective vibratory area is 55 mm square. Now, this is the tympanic membrane cut open and presented here. This is the lateral surface and this is the medial surface. The medial surface is going to face the middle ear and the lateral surface is going to face the external auditory canal. Let's move forward and look at the parts of the tympanic membrane. When we study the tympanic membrane, we study it in four quadrants. These four quadrants are posterior-superior, posterior-inferior, antero-inferior, and antero-superior. Let me make some space here. The upper one-third part is known as pars flaccida. This pars flaccida is also known as the shrapnel's membrane. The lower two-third is known as the pars tens. This light here which we are seeing in the antero-inferior quadrant, this light is known as the cone of light. Umbo is part of pars tensa where the tympanic membrane attaches to the tip of the handle of malleus. And the cone of light also arises from the umbo. This rim here, this whole circular rim is known as the annulus. This is the anterior malleolar fold. This is the posterior malleolar fold. The fibrous annulus, the malleolar folds and the tympanic sulcus, all these three are part of pars tensa. Here is a notch in the bone over pars flaccida. This notch is known as the notch of Rivinus. These are the parts of the tympanic membrane. Next topic is the side identification. These are the malleolar folds and this is the handle of malleus. The handle of malleus is in the superior quadrant and the cone of light is in the antero-inferior quadrant. So we can understand that here is the antero-inferior side. That means this is the inferior side. This is the anterior side. If this is the anterior side is going to face the face. This is the face here and this is the ear. Now from the pic we can understand that this is a left ear. Okay, that's how easy it is. Now answer this question yourself. This is the handle of malleus. We have the cone of light here. So the cone of light is like this. So this is going to be the anterior side. This is going to be the inferior side. So if a man is like this, so this has to be the right ear. Comment if you have answered this correctly. Next, we will look at some structures of middle ear which are visible through the tympanic membrane. In the anterior side, we can see the opening of eustachian tube. Note that this is seen very rarely, okay? We can see the shadow of incus, then next we can see incudostapedial joint, and lastly we can see the shadow of the round window. Please tell me if it was helpful, and also I have made some videos on ear pinna if you would like to check them. Thank you.